comfortable. I'm going to help her, right? And so the first thing that I do, even if I'm doing these, is just to kind of feel just what kind of scapular movement she has. Now notice that here and here, right, I kind of just go up and then down. Now, the scapula is going to rotate protraction. So this is anterior elevation. This is posterior retraction. So as she anteriorly rotates, the scapula protracts. As she's coming posterior, there's a retraction, okay? So now the first thing is I'm going to tell her, I'm going to move on your body forward and back. I want you to feel it, right? And as I'm going, I'm giving her directions. So we're going up, and we're going down. We're going up, and we're going down. All right, ready? Now look what happens when I do a quick stretch. Up, 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 up. Hold, hold, hold. Down, down, down. Push up, push down against me. Down, 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 down. Hold it, hold it, hold it. And up, 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 up. Hold, 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 hold. And push down against me, push down against me.
Back,
Yep,
going?
yep. Good. And now scapular movement is not that easy. But now she has a lot of mobility, and if I actually push down, I actually have greater range. Felt that, right? Mm-hmm. Okay. So because the scapula and the clavicle are very fragile, I find and that 2 fingers is just enough. You don't want to crowd. You don't want to overstimulate the shoulder, because I'm not working on the shoulder. I'm specifically trying to just work on the scapula humeral mobility. Now obviously we usually have greater anterior, less stability in depression, right? And so when you're going to give depression, you're going to try to angle yourself at that scapula, but you can't push around the rib cage. You have to try to stay within that inferior border of the scapula. And now I can give the full range, or I could work mid-range. I don't have to give the full range. Now, if, for example, she had adhesions, right? Basically, no scapular mobility, I would just passively move it. We could move it together, active assisted. I want you to lift up, and I want you to push down against. Lift up, push down. Okay, and then the first one I resisted, but you saw that I used quick stretch, isometric at whichever angle I wanted, and then pull back. Okay, thank you. Now we're gonna go to the pelvis. This becomes a little bit more uncomfortable, but basically your position is anterior and then inferior. And so basically I'm going to pull up and push down. Pull up. Good. And actually just hold yourself here. So you're going to pull up. Okay, not with your leg. You're going to actually, I'm going to push you. You just feel, okay? So you're going to pull up and push down. Pull up, push down. Pull up, push down.
So you're doing,
Exactly.
so you're opposite. You're doing actually when she's pushing down,
Yes.
you pushing up.
Yeah.
Oh,
But you
She's
push.
pushing down this way,
yeah.
and I'm asking her to pull up,
Ah, okay.
push down.
And every time it increased in pressure. It was like a little bit, and then it was more, and it was more, and it was
Ah, that's
And so
how you
can-
facilitate that on the joint
Right.
resistance.
I'm
Yeah.
feeling her, and I'm like, oh, I can give a little bit more. But I'm not holding, I'm giving it just enough so she can come down.
Almost assisting.
Yeah, just
So she
raising
has to
my own
do-
resistance.
She has to do more
Exactly.
most of the
and
work,
at times
and then
when I can give more, I give more. When I feel like she's getting
Okay.
weaker, then I give less, right? And each time I can kind of give more, right?
okay.
And so at this point, let's say I wanted her to come up. Pull, push, 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 push. You see that? Now I'm kind of ready. Pull, 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 pull. You see how now I can do both. I can work on her pelvis and I can work on the lower extremity. And so you can see if someone is not, if you're working on segmental rolling, this works on that segmental rolling, right? If you have somebody who's just now bringing their leg into rolling, then you can work on that. Make sense?
Are you trying to stabilize the torso trunk at least?
Here?
Yeah, here. No.
Remember, the lumbar has to move.
Okay.
I have to move my lumbar. So my focus is not my lumbar, my focus is here. As she's doing this, she's actually contracting her abdominals at the same time. So if we are coming here, ready, pull up, pull up, pull up, pull up, hold, 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 and if I resist, hold, hold, pull up, pull up, pull up, pull up, pull up. Good, good. Now she's going to work her abdominals.
And when you did just the hip, you asked how to push against this hand.
Both, up here.
Yeah,
up here.
Right.
Iliac crest,
Right.
yeah,
And then
pushing
against
down.
This, and of course naturally she was moving her leg. a
Yeah,
lot, but-
naturally, it just happens very easily.
Yeah, yeah.
Right, because it's just, remember, overflow, it's a natural pattern. Okay?
It's cool, I can feel it kicking in.
You do, right? I mean, and it's very natural. Remember, this is very easy stress. You're strengthening, but you're not adding a lot of pressure on the joints. You're not adding a lot of stress on other parts of the body. So if you have a multiple sclerosis patient, or if you have patients who have degenerative conditions, if you think about it, this is great. It's an elderly patient, right? Because if you think about it, resisting with weights and things like that are external factors. You're adding torque. You're adding torque to maybe someone who has osteoporosis. And I'm tailoring my resistance to you.
And you're already in a position where you're not against gravity, so.
Exactly. And perfect. So let's say sideline, I'm actually not allowing any of those reflexes, the brain reflexes, stem reflexes to return. So the reflexes are not at play here, and now I can strengthen you, provide you that motor control, and then we'll be fine.
How many times you would repeat
About
exactly?
5 reps.
5 reps.
Because it is very, believe it or not, with every one, you're recruiting as many motor units as possible. It's very tiring, actually.
Yeah, if I was immobile, that would have been hard.
Yeah.
Oh yeah.
So that is the scapular and hip.
Hip.
Obviously, you have to have somebody more comfortable with the pelvis. But honestly, most people, when they are meeting you, they're comfortable. They know that you're there for a right reason and things like that. But it is definitely more of a contact. All right? So that's that. Okay, thank you, Meg.